Okay, I think we'll just start because we could not. I can't think. It's already 7 minutes past 12. So I would be introducing the two speakers for today. Then after the introduction, we'll start this seminar. And while we are listening, if you have any questions, we jot them down in the chat box. And once both speakers are done, we'll take the questions together. My name is Uzoku Ngozi. I'm the moderator for today's seminar. So, beginning with the first speaker, I'm just introducing both Farm Bethel KK and Farm Adekola Ujola. I'm introducing Farm Adeola Ujola first. Farm Adekola Ujola is a seasoned pharmacist with over 22 years of experience, including 12 years at GSK, where he held various leadership roles as Group Product Manager Vaccines. He achieved double-digit growth and launched key vaccine brands, including measles, mumps, rubella, and varicella, hepatitis A and B, and meningitis. He has also trained over 1,000 healthcare professionals on vaccines value and received recognition for his work on the International Papillomavirus Conference. Additionally, he has overseen national vaccine distribution and currently runs a monthly podcast titled Preventive Health Nigeria with a global audience. As an independent consultant, he facilitates vaccination training for pharma organizations interested in venturing into the private market vaccines and has led a masterclass of vaccination at the PSN Lagos Scientific Conference. Meet one of our guest speakers for today, Farm Adekola Wujola. Then introducing the second speaker as well. Farm Bethel Okeke is a dedicated pharmacist deeply committed to advancing public health through the vigilant pharmacovigilance and strategic supply chain management. Currently, Bethel holds a pivotal role within the Pharmacovigilance Directorate at NAFDAC, specializing in the surveillance of adverse drug reactions and adverse effects following immunization. The core objective, safeguarding public health by ensuring the safety and efficacy of pharmaceutical interventions. In addition to his role at NAFDAC, Bethel is a founder of AfriVax, a non-governmental organization dedicated to promoting vaccine access, equity, and awareness in Africa. Bethel's unwavering commitment to professional development led him to acquire the title of Infodemic Manager, courtesy of renowned programs by WHO, UNICEF, and Gavi. Our second speaker for today, introducing from Bethel Okeke. So, with this introduction, I think we can have our first speaker presenting.
Good afternoon. Thank you very much for the introduction. Am I going first or I think I'm going second, right?
Yeah, I'm trying to share my slide from color.
All right, go ahead, sir. Go ahead, sir. I'll come up. Thank you so much. Thank you, sir.
All right, it's a pleasure to be here. My name is Farm Bethel Okeke, and I want to recognize the presence of Farm Kola Ujola, who has been doing so great in the field of vaccination. I also want to really thank PSN-YPG for the privilege to be here to present and make this presentation. So I think at this juncture, I would want to share my slides so that we can quickly get the meat of the program. I hope I'm permitted to.
Yes, you are from Bethel.
All right, thank you very much. So if you can confirm that you can see my slide, I would really appreciate that. So can you see my slide? Is it on slideshow?
Yes, yes, you can see it.
All right. So the presentation given to me is on impact on communities and barriers to elimination as regards hepatitis or viral hepatitis. In the course of our presentation, or this presentation rather, we'll look at an introduction to viral hepatitis, the impact of viral hepatitis on Nigerian communities, the types of viral hepatitis we have, but with particular emphasis on hepatitis B. We're going to look at the management, call to action, and then a conclusion to what we have today. So as an introduction, viral hepatitis is the inflammation of the liver caused by one of the 5 main hepatitis viruses, where we have hepatitis A, B, C, D, and E. We're going to look at them one by one, but what are the facts around viral hepatitis? One of them is that 1 in every 12 persons worldwide is living with viral hepatitis, which is giving us an approximate number of 240 million persons who are infected with chronic hepatitis B virus. And then 80 million people are infected with chronic hepatitis C virus infection. And globally, we have an estimated number of 7% of primary liver cancer and 54% of liver cirrhosis caused by viral hepatitis. So currently, 1.4 million people die every year to viral hepatitis, and that is why this webinar we have now is really important. But what is the prevalence in Nigeria? Well, all over the world, Nigeria is among the countries that has the highest burden of viral hepatitis. Hepatitis B virus, 11%, we have a prevalence of 11% in Nigeria, and then 2.2% for hepatitis C virus. That's the prevalence. Now, for sexual distribution, the way hepatitis B virus and C virus are distributed in Nigeria is interesting. We have that 2% of males and 7.4% of females possess or have this hepatitis B virus. So when we look at the total number of people who have hepatitis B and hepatitis C virus, 62% of them are males, while that 7.4% are females. And then for hepatitis C virus, 2.4% are males, and then for 7.6% of them are females. What is the striking feature here? The striking thing here is that more males possess both hepatitis B and C virus here in Nigeria, and this is something that we want to look at. Now, which population is more at risk when it comes to these particular, ailments we're talking about, or these forms of viral hepatitis? We have infections are most common among 21 to 40 years olds. Medical personnel, especially surgeons, dentists, are at great risk of infection, and other healthcare workers, which is where pharmacists come into the picture. We also have commercial sex workers and drivers. These people are population that are at risk. But we're going to talk about these forms of hepatitis individually, because we are health experts and want to have good knowledge of them, especially as young pharmacists, and being able to provide care. As Riley said, viral hepatitis has 5 major types. We have A, B, C, D, and E. However, they
Sorry,
vary.
is your slide supposed to be moving because it's not moving?
It's actually moving from my end. Okay. I think.
Just saw
Can
it
you see
now.
my?
Yes,
Can you see my
I'm
slide?
just seeing it now. Yes, on later.
Oh wow. I don't know. But it's moving over time. I've been trying to move it.
It's moving from here.
Okay, it's moving from there.
You just started.
Yeah, now that you're moving it, but initially it wasn't moving at all.
All right, so you permit me to have it this way. I'm not on slideshow because it seems if it's on slideshow, it can move from my end. All right, so we've talked about the prevalence in Nigeria. We have 11% for hepatitis B virus, and then 2.2% for hepatitis C virus. And Nigeria is among the countries that has the highest burden of viral hepatitis. Now, in the serial distribution, 62% of them are males. So for hepatitis B virus, the total number of persons who have hepatitis B virus in Nigeria, 2.6% of them are males, while that 7.4% of them are females. And then for hepatitis C virus, 52.4% are males and 47.6% are females. Now, if we look at the population at risk, as I've rightly talked about earlier, we have that other healthcare workers, which is where pharmacists fall into the picture, are at risk. And then infections are most common for people who are within the ages of 20 to 40 years old. Now, the different types of hepatitis B, viral hepatitis we have hepatitis A, B, C, D, and E. But we are going to pay more attention to hepatitis B because the prevalence is higher here in our country, Nigeria, and want to see what we as pharmacists can do to it. So let us talk about hepatitis A. We're just going to talk about them gradually, just in chunks, and then go over to hepatitis B. For hepatitis A virus, it is spread via fecal oral contamination. So if somebody ingests something that's, when the person is unvaccinated and then ingests food or water that is contaminated with feces of an infected person, that person runs the risk of getting hepatitis A virus. But there's something that is beautiful here. Hepatitis A virus rarely causes death. So unlike hepatitis B virus, hepatitis C that can cause chronic liver disease, or that is very, very fatal rather, hepatitis A virus rarely causes death. But its mode of transmission is fecal oral routes. Now, we also have hepatitis B virus, which is the major one we're talking about. It is a vaccine preventable disease. It can be transmitted through blood, semen, and other body fluids, even via sweat. And it is important to note that hepatitis B virus is 50 to 100 times much more infectious than HIV. Because today you hear people say, I'm having unprotected sex, I'm just scared of HIV. What of hepatitis B virus? Because they think that it is not infectious too. They lack knowledge about it. So yes, hepatitis B virus is 50 to 100 times more infection than HIV. And there are various routes of modes of transmission. We have perinatal transmission from mother to child. We have unprotected sexual intercourse. We have transmission via using needles and syringes that has been used by other people who are positive to this virus. And then globally, it has been estimated that 2 billion people have been infected with hepatitis B virus. Approximately 240 million people are chronically infected with hepatitis B virus. And then this is giving us an approximate number of 30% of people who are estimated to go down with liver disease. Because, as rightly said earlier, hepatitis A virus is really fatal when compared to hepatitis B and C, which both of them are really fatal and can develop liver disease. Now, let's quickly talk about hepatitis C virus. Hepatitis C virus is also a blood-borne virus, but this time it is not as infectious as hepatitis B. It is rather 10 times more infectious than HIV. So both hepatitis B and C are more infectious than HIV, but their rate of being infectious varies. And currently, there is no vaccine available for hepatitis C virus. Some common modes of transmission are unsafe medical procedures, using sharp needles that has been used by somebody who is infected by hepatitis C. What of hepatitis D? Well, we want to note that hepatitis D virus occurs exclusively in people who are already infected with hepatitis B virus. So it means that if somebody has hepatitis B, there is a high likelihood that the person most likely might also have hepatitis D virus. But the beautiful thing here is that vaccination for hepatitis B virus tends to protect people too from hepatitis D. So even though we don't literally have say, okay, this is a vaccine for hepatitis D, but if somebody is vaccinated for hepatitis B, the person tends to have more like a cross immunity to hepatitis D too, especially if the person is negative for hepatitis B. So yes, taking hepatitis B vaccine protects you against both hepatitis B and hepatitis D infections. Now let's talk about hepatitis E. Hepatitis E is transmitted mainly through through contaminated drinking water and food, but it is self-limiting. So unlike other forms of hepatitis we have, if you have hepatitis E, within 4 to 6 weeks, you are okay. It is self-limiting, and thereby, hospitalization is not required. But we also have to be very, very careful. Now, having talked about all these forms of hepatitis we have, it is only obvious now that the problem we have here is majorly two: hepatitis B and hepatitis C. Hepatitis B, which is vaccine preventable, and hepatitis C, which is does not have any vaccines currently for it. Now, how can we manage this? We are going to talk about prevention more, because in public health, we say prevention is better than cure. But before we go into management and prevention, I want to be sure that someone is you can hear me very well, so I don't keep talking to myself. So I want to be sure that Margaret is hearing me. Margaret Dixon, can you hear me?
Yes, I can hear you, sir.
All right, thank you very much. I hope Ngozi Zokwetu can hear me too.
I can hear you, Better.
All right. Thank you very much for that. So I think we can head on to the management. So under management, you're having prevention and treatment. And for prevention, it is important to know that we are going to talk about prevention here in when it comes to mother to child, infant prevention, adult prevention, lower children prevention, like children who are in the ages of 1 to 11 years, and then people who are above 11 years. We're going to talk about their prevention. And we as pharmacists want to pay rapt attention to this because it's very, very important. Now, when it comes to prevention for mother to child transmission, we administer hepatitis B vaccine to the mothers, along with concurrent administration of hepatitis B immunoglobulin and an administration of an oral nucleotide analog to an infected mother. So if a woman is infected of hepatitis B already, what we say is you administer the hepatitis B vaccine, administer the HBIG and a nucleotide analog to this woman within 28 week upward of pregnancy delivery. That is in the third trimester. And the recommended drugs for or the recommended drugs tenofovir and lamivudine. Yeah, the recommended ones. Before now, we used to use another medication. I can't remember the name exactly, but the WHO said it is not allowed in women. Like it is not recommended in women because it is obviously teratogenic. I'm trying to remember the exact name for that, but I think I'll get it towards the end of my presentation. I can't remember exactly now. So what are we trying to say in a sense? We're trying to say that for women who are positive to this very hepatitis B, we administer the vaccine to them. Then we administer HBIG, which is hepatitis B immunoglobulin, and then I'll also administer an oral nucleotide. But we want to note that the administration of hepatitis B vaccine and the concurrent administration of hepatitis B immunoglobulin are done at different sites, so it's not done at a particular site. Now, if a baby is exposed, that is, this baby has been born to a mother that is positive, the baby will receive hepatitis B immunoglobulin intramuscularly along with the hepatitis B vaccine. That is immediately after birth. That is 24 hours immediately after birth. The person has to receive it. So the hepatitis B immunoglobulin must be given to this child within 24 hours of birth, along with 1 dose of hepatitis B vaccine. And as you rightly said, the site of administration has to vary. I hope this is clear. Now, for prevention in infants, that is immediately after birth, infants are given 4 doses of this vaccine. First off, they are given a monovalent vaccine. The monovalent vaccine is within the 24 hours of life. So once you give birth to a child, administer monovalent vaccine of hepatitis B vaccine. But the 3 remaining doses are administered at 6, 10, and 14 weeks. So the 6, and those ones are no longer monovalent, they are now pentavalent. The pentavalent vaccines has 5 in 1. That's the 5 in 1 vaccine. We have the pertussis, tetanus, hepatitis B, and HIV. That is human, not human, rather, Haemophilus influenza type B, type B. So these 5 are in 1. That's called pentavalent vaccine. And these pentavalent vaccines are administered 6 weeks, 10 weeks, and 14 weeks to be able to complete the hepatitis B vaccination of these children. That is infants. So we want to take note of this. That is the prevention of this form of hepatitis in infants. Now, for children who are lower, like children who are within the age of 1 to 11 years, we administer the monovalent hepatitis B vaccine 3 times: 0 months, 1 and 6 months. So that is how we space it: 0, 1, 6 months. And the dose we give them is 10 milligram per 0.5 ml, and it is administered IM. But now, note another thing now. For people who are above the ages of, this is not 1 to 11 years, please. I'm sorry for the misnomer. It's actually people who are greater than 11 years, please. So for greater than 11 years, what we do is we administer same duration or same gapping, but we double the dose. So it's now 20 microgram per 0.5 ml, and it's still administered intramuscularly. So let me reiterate. If it's between the age of 1 to 11 years, 0, 1, 6 months, and 10 microgram per ml, per 0.5 ml. But if it is within the ages of 11 years and above, then we're now going to administer 20 microgram per 0.5 ml. But then there is something else here for people who are special population, that is HIV, people who are under hemodialysis, and immunocompromised patients. We administer 4 doses to them: 0, 1, 2, and 6 months. The 4th dose must be added. That is 1. 2, the dose must be doubled to 40 microgram per 0.5 ml. Note the difference. For people who are adults, we just give 0, 1 to 6 months. That is 3 doses, and it is 20 microgram per 0.5 ml. But for people who are immunocompromised, have HIV, hemodialysis, we double the dose first, 40 microgram. Then we administer 0, 1, 2, 6. So 4 doses. And I think this is very, very clear now. Now, how can we prevent hepatitis B transmission in healthcare settings? This one is very, very important to us, because sometimes in the pharmacy, you can administer it, or you can be in a condition where, there might be pricks, or there might be, mistakes can happen. So how can we prevent hepatitis B transmission in healthcare settings? First is washing your hand. Hand washing is very, very important, including surgical hand preparation and use of gloves. Pharmacies these days don't, this practice of using gloves seems to be like, it has left the practice, but it has not, because it can protect us. Safe handling and disposal of sharps and waste is very, very important. When you are done with your wastage, your waste, you want to be sure that we handle them safely. You don't want to dispose them carelessly. We also have safe clean of equipment. Clean of equipment that we use in the pharmacy is very, very important. For people who donate blood, it is important that donated blood is properly screened, and donated blood products are properly screened too. There should be improved access to safe blood. Vaccination of healthcare workers is very, very important. If you're a pharmacist on this call and you have not gotten the hepatitis B vaccine, please, I must tell you that you're not doing it right. Honestly, please try and get the vaccine. Obviously, vaccination is not something that you force someone to do, but for we as healthcare workers, we want to get vaccinated, because we want to protect ourselves first before we can protect the lives of our patients. Additionally, it is also important that we build capacity. So capacity building of healthcare personnel is also very, very important to prevent hepatitis B transmission in healthcare settings. And this is one of the ways why we should build capacity. We learn about it, we attend conferences. Kudo has been doing lots of things in his organization, and time and again want to join in to learn about ways, or the latest trends in the world of vaccination. Additionally, too, sometimes there might be exposure already. So in case of post-exposure, what can we do? One, we want to wash the wound, or the exposed wound, with soap and water, and flush the mucous membrane with water. Secondly, if you notice that the person that you had contact with has already has been screened of hepatitis B, hepatitis HIV and HCV, and then it has been noticed that the person is positive, what can you do? Well, whether the source is positive or you don't know the source, it is better that you get HBIG. HBIG should be administered intramuscularly, and then active vaccination should be commenced between the months of 0, 1, and 6. That is, if you identify that the person is positive, or the source is not known. It is very important that you get HBIG and get the vaccination too. So this is ways by which you can prevent hepatitis B, or transmission of hepatitis B in the healthcare setting. Now, what of the treatment? The treatment is very, very important. In all adults, adolescents, children who are within the age of 12 and above, we prefer the use of tenofovir. Tenofovir is a drug of choice, or you can also use entecavir. Now, I'm sorry, please. The drug I was talking about earlier was actually entecavir. Entecavir is contraindicated in women because of its cause of toxicity. For entecavir is recommended in children between the ages of 2 to 11, or those who cannot tolerate tenofovir. For some people, when they are given tenofovir, there are cases of maybe renal impairment and all of that. So we say you can actually administer entecavir. So now, it is not just about the treatment. What can we do, or what are some barriers to elimination for hepatitis B? The first one is limited awareness and knowledge. Yes, people lack knowledge about viral hepatitis. A lot of it. In fact, I remember when I was still in the community pharmacy setting, I met up with a patient, and she told me that she never had hepatitis B, or that there's nothing like hepatitis B in her system. And I was like, ma, it's not just about. He said it's not her portion. That hepatitis B is not her portion. Well, I had to send this woman to hepatitis B, and well, she came out negative anyway. But when she went to run the test, some people who came to run the test too, some indicated to be positive. So immediately she came back, she said she wants to take the vaccine. That what she saw there, that she doesn't like it. So people lack awareness and knowledge to hepatitis or viral hepatitis, and this is one of the barriers to elimination. The second one is stigma. People are scared that if they say that they have viral hepatitis just as HIV, that they can be discriminated or they can face stigma. And that is why they prevent or don't seek treatment or diagnosis. Another one is sufficient funding and resources. Yes, this is a problem. So most of us on the call can confirm to the fact that the cost of vaccines now are on the rise. Some months ago, hepatitis B vaccine was a little above 2,000. Get administration for 2,000, sometimes 1,000. But now the prices are skyrocketing. So insufficient funding and resources is a problem. And that is also inadequate screening and diagnostic facilities. Yes, many healthcare facilities lack the necessary equipment and trained personnel to provide accurate and time diagnosis of viral hepatitis. And this is giving lots of problem. Another one is limited access to vaccination. If you go to some general hospitals today, and even in some primary healthcare settings, they don't have hepatitis B vaccines. Most hospitals don't have hepatitis B vaccine. How will people get these vaccines if we don't give it to them, or if they don't have access to it? So yes, hepatitis B vaccine there is limited coverage of it, especially in rural settings and areas that are hard to reach. Another thing is cost of treatment, poor healthcare infrastructure. These are barriers to hepatitis B vaccine elimination, or hepatitis B elimination, or even viral hepatitis elimination. But what can young pharmacists do? I think this is where we want to have a one-to-one, because all of us here are pharmacists, and I'm sure we know what to do. So let us open the floor to people to comment on what they think pharmacists can do, young pharmacists can do, to be able to combat these rising cases of viral hepatitis in the country. Let's hear from Enoch Ikechukwu. Enoch, please unmute your mic. What do you think we can do as young pharmacists to be able to ensure that we combat the rising cases of viral hepatitis in Nigeria? Enoch, are you there? Okay, let's hear from you, Margaret Dixon. What can we do? Okay. Eniola, can you please unmute your mic? Eniola Aina. Am I heard? I need to be sure I'm heard.
Yes, you're heard. Maybe not everybody
Okay.
is prepared to say something after. Okay, she's here.
All right. Eniola, we can hear you, please. Okay. Let's hear from Deborah. Oyedonyi.
Okay, sir. Well, you have mentioned some of them, like raising awareness and also conducting researches is also good. I think mostly we can do more, especially for the community pharmacy, by raising awareness, promoting knowledge about vaccine amongst our patients, and both working patients, mostly working, and the community.
That's powerful. Thank you very much for that one. Tekena George, can we hear you? Tekena George. I don't know if I'm pronouncing it right. Tekena. All right. Let's hear from you, Okenwa Raphael. Okay. Yeah, Eniola, you can go on, please.
Okay, thank you. So as pharmacists, we can educate the public, like let them know more about hepatitis, because sometimes it's ignorance. People don't know about it. They don't know, maybe the symptoms or like what it can cause. So educating the public and letting them know that it's very important to actually prevent it. So I think that's what we can do.
Thank you very much for that. Okay, let's get one more person comment before we continue. Let's hear from Okenwa Raphael. Okenwa Raphael, can we hear you?
Okay, good day, everyone. I think as healthcare professionals and healthcare providers, we should try to make it easy for people to access treatment and kind of reduce the charges um there for them to be able to get the knowledge they need. Because sometimes the cost can be a problem in while trying to create awareness. So that's my 2 cents.
Your 2 cents is powerful. Thank you very much for that. So yes, we have said it all. Raise awareness. Young pharmacists can raise awareness. Yes, raise awareness in your pharmacy outlet. Raise awareness in the hospital. Raise awareness amongst your friends. Raise awareness. Raise awareness. Awareness is the problem. Awareness is the problem. Irrespective of the amount of money that is put into vaccination, UNICEF said that for every $1 that is invested in vaccination, $44 is saved by the federal government. So it means that if that $1 is not, even if it is invested and there's no proper awareness, the vaccines are not utilized or are not administered, that would be a waste. So let us raise awareness in the pharmacy outlets that we are in. And that thing is also advocating for funding. Young pharmacists can advocate for funding, and funding opportunities from, politicians, from non-governmental organizations, from governmental organizations and alike, to be able to ensure that we help to eliminate viral hepatitis. And that one is also promoting vaccination. We are in the World Hepatitis, the World Hepatitis Day is soon to come. What are you doing in your outlets to be able to ensure that you promote vaccination? Do you have any provision for an outreach? Do you wish to join anyone? I'm very sure that the Young Pharmacists Group, the YPG Lagos, is making preparations to maybe conduct an outreach in one or two places. What are you doing to join these initiatives? These are ways that we can work together to ensure that we eliminate this disease that is disturbing the whole, the country. And that is also providing education. Providing education goes hand in glove with raising awareness. Supporting screening initiatives can also be an opportunity that young pharmacists too can also, engage in ensuring that they eliminate viral hepatitis. And that one is engaging in community outreaches. Yes, engage in community outreaches. If you have a community pharmacy outlet that you want to, carry out a vaccination program in, you can reach out to non-governmental organizations like AfriVax Health Aid Foundation. Yeah, you can already found of AfriVax and say, we want to carry out an outreach around this field, and then we can put us together and collaborate effectively to ensure that these outreaches are organized in your community to ensure that we eliminate the problems we have around viral hepatitis. We want to also collaborate with other healthcare providers. I want to comment on this. If you notice cases of hepatitis B, don't try to manage it in your facility. If somebody is positive of hepatitis B or other forms of hepatitis, don't try to manage it in your outlets. Just refer. Because most of the time we see that we try to manage these people and manage them, and you see that there might be therapeutic failure, and cases of liver cirrhosis will arise. So we want to know when to properly refer our patients to other healthcare providers to manage them. Because you are the Gen Z generation, or obviously you are for some other most young pharmacists who are Gen Zs, we want to utilize social media. Social media is a very powerful tool for enhancing awareness. So we want to enhance awareness of our social media handles, LinkedIn, Instagram, X, and even our WhatsApp pages that can help to combat this disease. And that one's also conducting research. Yes, conducting research can tell us where the gaps are in a particular locality. Are the gaps as regards are there behavioral and shared drivers that are concerning vaccination that need to be tackled? These are things that research can do for us. So yes, we want to work hand in glove to ensure that we join forces to be able to combat viral hepatitis today. I'm privileged to talk to you all, and I remain a pharmacist, Bethel. Okay, thank you very much for having me. Over.
Thank you
Thank you.
so much, from Bethel, for this wonderful seminar. You took us through hepatitis as a whole, and I think I myself left with something extra. I thought I've heard it all, but he still brought some things to our notice that we've not heard. So thank you so much for that, and also the engagement as well. So we're moving on. Every questions we have, we should just note them down and by the end of the second speaker, we will take all the questions. So we are calling on Farm Adekola Ujola to take turn to speak.
Good afternoon, everyone. I'm
Good
confirming
afternoon,
whether
sir.
I'm being well heard. Thank you,
Oh, thank you,
everyone.
everyone. Good afternoon, sir. I can hear you, sir.
Thank you so
Thank you
much.
so much.
Thank you so much for that wonderful presentation. Very lucid and very engaging. I really, really enjoyed it, and I learned a lot as well. Thank you. Thank you so much. Great job. How do I share my screen now? Let me see. I'm a Zoom person, so but I'll get it now. Let me see. Present now. Okay. Let me see. Uh,
If you go to the three dots down your screen, you would see share screen.
Okay. Can you see my screen now?
Yes, yes, it's up.
Okay. Let me put it on. Okay. I want to share my screen. All the page. Um, can you still see it?
Yes, we can.
Yes, we can.
Is it on full screen now?
It's
No,
fine.
it's
Yeah,
not.
Is
but
it
it's
on full
fine. We can
screen?
still go with it. No, it's not yet on full screen.
Okay. Hold on then. I want it to be on full screen. Uh, that's finish. Okay, hold on, please. Okay, so
I think we could just continue if there's an issue with sharing,
mm,
making it full screen.
mm, uh, let's see. Okay, let me just continue. Although it makes it more. Let's see. Mm,
Mm,
Kola, do you want us to have the slides so we can share it on your behalf?
because because give me a minute. Let me start presenting. Oh, um, okay, I'll let me just send this. Let me just send it to one of you.
Okay, sir.
Google Meet. Okay.
Okay, so please, while we are waiting from Kola to share the slides, please, I have put up something on the chat box. If you are here and you can drop your full name and your email address for a certificate of participation and attendance, just to appreciate you for your commitment and for your participation. Thank you.
From Kola,
Yeah,
Mr.
I'll
Kola,
send it to you.
if
Just a minute, please.
okay, so you can use your icon. You go down to where you have this comment. Yes, comment, note comments, then come down to the last icon
Mm-hmm.
before you have the Zoom icon.
Mm-hmm.
Where you have the last icon before the Zoom icon. You're not yet you're not there yet.
This one, right?
Can't see your icon again. Okay, I've seen it. So where you have this plus and minus sign before then,
Mm-hmm. Mm-hmm.
Can you see?
Okay, you know what I'll do? This one.
I can't see your icon any longer. On the
Okay, let me just
presentation
send.
itself,
Let me send this thing to Oluchi. Let me see.
or you preview.
Oluchi, I've sent it to you. Please just present from your end, please.
Okay, sir. I'm coming.
Just present from your end. I'm not used to this your. I've sent it to someone. There's some things I edited in that the one I sent to you that I just thought I needed to present them as well. Okay, please present from your end so that I'll just follow. I sent it to them. Apologies for all that.
Okay, sir. Please just give me a little time.
Mhm.
Upload that immediately.
Hello, Luchi. Do you have it now? Are you presenting?
Sir, if you can
If you
try
can try.
different sharing the way you were sharing the other time, that it wasn't full screen. I think we can work with that, sir.
Yeah, but then the issue was it wasn't changing. What is this? Huh?
Sorry, sir. My laptop is currently updating, and I don't know why it's decided to update right now instead of.
So now
So now you can see you can
this
see this
screen.
screen
But why is it not changing?
changing. Maybe you have to be clicking on the page you want us to view.
And that's what
And
I'm
that's what I'm
doing.
doing. But it's not changing despite that.
Yeah, that's
Yeah,
that.
that's the
And I'm
problem. And I'm
trying to.
trying.
That's the
That's the
issue. I know you
issue.
can
I know you
see
can
it.
see it. Hmm.
I
I
wonder why.
wonder what.
See.
The laptop.
So let's just wait for maybe it's a setting in the laptop that needs to change or something. Let's just wait for.
I'm trying to share the slide now, but I don't know if anyone can see it from my end.
Well, Oluchi, why don't you share with someone else that might have a laptop
I
that can share?
Okay, let me see. Let me
Just
see.
get
Just get
everyone.
8 minutes. Fambeto, please, if you're here, can you assist us? Fambeto, please.
Okay, what do I do exactly?
Have you sent it to someone else that has
That
a
has a
laptop?
laptop. I'll send it to Fambeto right now, and he can help us to share
All
it,
right.
sir. All right. All right. Thank you, sir.
Send it to my email. I will send you my email right away.
Hmm?
Fambeto, please, have you seen it? I've sent it to you via email.
Please, which email did you send it to?
Afrivax email.
All right.
All right.
Can you see my
Can you see my
screen?
screen? Have you seen it? Okay.
Can you see my screen?
Yes, I can
I
see
can
it.
see
I can
your
see your
screen.
screen.
Okay, go ahead
Okay, go
and
ahead and
share now.
share now. Thank you very much, Pambeto, for
Thank you very
Thank you
much.
very much.
Please,
Thank you.
can you
Please,
put it
can you
on
put
full
it on
screen?
full screen?
Okay, good afternoon, everyone. Apologies for this mix-up. It's very much unexpected. So I want to talk briefly on facilitating partnerships and community support for improved hepatitis awareness and prevention. So very briefly, this will be my flow, and I'm happy that the proud speaker has said a lot, and he has laid a very good foundation for me to, discuss this. It's important we keep talking about these things so we know how best to approach. He has already talked about the interventions, the prevention, and what pharmacists can do to help. So he has done the major part of the job. Please, can you change to the next screen? So this will be my flow. I have 20 minutes to do this or less so that we can go on to questions and answers. Hepatitis in Nigeria, current level of awareness. We'll look at partnerships and support needed to drive the desired end of awareness. Then we'll talk about the two prongs of engaging the HCP and then, very importantly, engaging the community in hepatitis. Um, so hepatitis in Nigeria, uh, just like the prior speaker has said, the hepatitis cases in Nigeria have been soaring. It's bad enough that Africa has 26% of global burden. That means that 1 out of every 4 people that have hepatitis in the world is in Africa. But now, 1 out of every 4 of that again is found in Nigeria. So that means that if you see this about 20 million, if you see 10 patients in a day, like probably 1 out of those 10 has hepatitis. That is a very, very serious and very disturbing because uh, it means that Nigeria is endemic as far as WHO is concerned because the prevalence rate is over 9.5%. And the WHO said anything that's more than 8% is highly endemic. So this calls for a lot of concern. All right. And in 2022, just like you see it on the slide, we had the highest burden of hepatitis in Nigeria. It has not changed. I'm sure if we check the figures now, it probably has worsened. So what does that mean to us as pharmacists? We need to do something, just like the prior speaker said. We really need to, if we sit down, things will not get better. But if we do something, if we know how to engage stakeholders, if we know how to, form partnerships, and if we know how to engage the community and get their support, we probably might change this picture. The next slide, please. So what is a current, before we start talking about, facilitating, partnerships, getting support to improve the awareness, where are we currently? This map you see here is redacted. That means it's just a part of it I'm showing, but what it shows is that it's showing how prevalent and by the rule of the flip side, it's showing how low the level of awareness is in Nigeria. For example, there's a study in Zaria that shows that about 63% of the people with of the study was conducted in Zaria, and you can see that part of the responses was some of them even thought that hepatitis could be, contacted through food, Some thought it could be contacted through mosquito bites and so on. I saw a study done in America, and you'll be surprised that even in America, people could have very wrong perceptions about a disease as common as hepatitis. So now you can see that Zaria is in the north, and you can see that the north has the highest burden of hepatitis. And so, by the rule of flip, just like I said, the level of awareness in the north is far lower than in the south. You see that Lagos and the environs are yellow. The ones in white are those that have no data, according to this study. The ones that are yellow have a lower prevalence, and by flip, they have a higher level of awareness. So as we go up north, the level of awareness reduces and the level of prevalence. So we can say in a nutshell that the level of awareness is still low, and we really need to improve the current level of awareness, because by 2030, WHO is saying that we should be able to, the 1990 rule, we should be able to improve prevention, and we should be able to test up to 90% and even treat, something about 65%. So if we are going to achieve all this, we cannot achieve any of those numbers. Very, very ambitious, if you ask me, because we are in 2024. We have just 6 years. WHO made a statement very recently. He said we have just 6 years to meet this humongous target, and it looks as if we are reversing. We are not. I mean, in terms of the number of hepatitis cases and so on, it's increasing all over the world rather than reducing. So you and I have a lot to do in order to improve the current level of awareness, and in order for us to meet this humongous stature or diagnosing 90 and treating up to 65%. So please go on, please. The next slide. So obviously, what we need to do, nobody can succeed alone when it comes to vaccination, because vaccination, prevention, all these things are public health issues. So there is really no single individual that can do anything by himself. So that's why we say multi-stakeholder engagement is necessary to achieve greater impact and to ensure the sustainability of any intervention. Now, if you are in the vaccine space, you know about WHO as the governing party. You know about UNICEF, the procuring party. You know about Gavi, that is the paying party. So Gavi pays for it, UNICEF procures, WHO makes the rules. So all these big bodies have their various roles. So when you come to the Nigerian government, there's something, the federal government is the one that receives it, they bring it down to the states, then it gets as low as to the local government, to the grassroots. Until you're able to get vaccines to the grassroots, you've not been able to do anything. They can stay in the cold room in Abuja, or they can come to the cold chain room in Lagos and might not get into anybody's veins, and then they are useless. So now you need people to come together to be able to further, the cause of vaccination at any level. But now we're even talking about awareness now. So it's important that we know that collaboration is very, very important. There's government and there's government. And there's the non-government is what I want to focus on more, and also on community-based organizations. How do we do this? How do we excel at this so that we can change this picture? Very important. Very importantly, I need to tell you that we need to leverage on the existing infrastructure. You don't need to reinvent the wheels, because as we go further, you find out that the channels through which we are going to achieve this improved level of awareness, and which will lead to improved level of vaccination prevention and reaching this goal of 1990-65, is going to be through the existing infrastructure. Okay, we're going to go through the community health workers. We're going to go through the nurses. We're going to go through the pharmacists, the doctors. We are not going to go and train our own. We're going to use the people that are already existing. We also use the infrastructure that's existing. All right, we're going to use the hospitals that are existing, the pharmacies, the schools, the churches. Everything that is needed is already there. So, or why? Because if you don't leverage on what is already there, you just be making unnecessary expenditures that are not necessary. All right. So partnership is what will enable us to put infrastructure and human resource together. And when we leverage this, we will be able to get the best interventions in terms of raising their awareness and getting people to know their status and to be prevented and even to get treated for hepatitis. You know, the World Hepatitis Day, lingo is test, uh, vaccinate, and treat. So that's what we want to achieve through partnership. Yes. The next slide, please. So it's a two-pronged approach. You are going to be doing this awareness raising and knowledge, skills, and attitude improvement. Is first with the HCPs. The healthcare providers themselves are the first culprits. There's a study that shows that the number of healthcare professionals that have taken the hepatitis B vaccine anywhere in the world is no more than 53%, even in the advanced countries. If a place like Europe is recording about 53%, you can imagine our own right here in Nigeria. Okay, so when it comes to taking the vaccine, I could hear the previous speaker talking about if you're a pharmacist here and you have not taken the vaccine, we're the first culprit because it's when you are vaccinated that you can encourage somebody else to get vaccinated. If you don't believe in it for any reason or you have something against, I've met people that are very bitter against vaccines. They just think that the vaccines are evil machinations and so on and so forth. So until we get the HCPs convinced, we cannot get the general public. So the next one is direct to public awareness. So there's a statement here that shows that if we do not increase the level of awareness in the general public, what will happen is we are going to be having missed opportunities for prevention. When people don't even know their status, they will not go ahead and get treated. If they don't get treated, they will keep spreading the disease to many more people. If many more people get infected, then many more people are going to have liver cirrhosis, liver cancer, hepatocellular carcinoma, which is what we call the liver cancer, and many people are going to keep dying. Okay, so we are going to be able to get it right when we are able to get directly to the grassroots. But just like I said, it is first to the healthcare professionals and then to the general public. The next slide, please. So among the healthcare professionals, the first thing we need to do is to disseminate information about the prevalence. All right, they need to know how prevalent it is. Many do not know that 1 out of 10 of every patient they are seeing is having an ongoing infection of hepatitis B. All right, and just many in community pharmacies especially, they are satisfied with, oh, a patient comes in, we give him the drugs and he goes. There's no query about what do you know about hepatitis. People do not, just like the prior speaker talked about A, B, C, D, E. They don't even know that there's any other thing apart from B. They only know B, and maybe we are culprits too because we talk so much about B. Yeah, B could be B and C could be the most dangerous, but there's still A, there's still D, there's still E, and so on and so forth. All right. So we're going to also give them guidance on screening. The nurse, the doctor, the pharmacist, the lab scientist, we need to let them know how to screen. All right. Then apart from that, we have to give them the information on interpreting the screening results. There was a training we had, Professor Nyekwere is going to be speaking at our program next week. When I was in GSK, I was about to launch the only combination vaccine in the world, A and B, that's Twinrix. And as a product manager, I had to put together a training for the entire field force. And it was when we were going through that training that we realized that none of us was able to interpret the test results. So there are different types of test results. There's hepatitis B surface antigen, when it's positive, when it's negative. There's the antigen to the core. There's a core. So when the core when the core of that nucleus shows that it's negative, all right, or if it shows that it's positive, there are different things. There are like 10 interpretations of those results, and I wonder if the lab scientists that receive these results are actually doing justice to it. So we need to be able to train them. We also need to be able to bring them up to speed so that they also help us to reduce the stigma. It's really a big deal when people know that somebody has hepatitis, even within the family. How do you manage the husband, wife? How do you manage, all those? I could remember my in-law, they had a house, they got an house help that was hepatitis B positive. They sent her away. Got another one. For you to know how prevalent this thing is, the second one, hepatitis B positive, sent her away. Until I gave them, I think I gave them the information that, see, I'm not saying you shouldn't send them away, but vaccinate the whole family, and you can keep the maid if you really want the maid to work with you. That's the reality, because you don't have them. To get a good maid, you know what I'm talking about. So we need this information to go out. Information about health disparities, things that could happen, the drugs that should be used and so on, just like the power speaker said today. So these are things that we really need to deepen amongst healthcare professionals before we now go to the general public. So the next set of slides will be talking about how we engage with the general public. And if you look at this slide properly, you see that on the left you have the school, then you have the estates. That's where people, yeah, no, yeah, this same slide, yeah. You have the school, you have the estate to the left, and to the right you have the company. All right, then you have the church. These are very, very important places you need to get to be able to raise the awareness of hepatitis. And don't forget, we are talking about the A, we are talking about the B, the C. Rarely do you see an awareness meeting where you talk about all of them as they are deserving. Yes, you should talk more about some than the others, but you need to let people know everything. So just like I said previously, the lack of knowledge and awareness about hepatitis B and C in the community will lead to, missed opportunities for prevention, for treatment, and then eventually you have more people, getting infected with the hepatitis B. You can imagine a husband that does not know is hepatitis B positive, gets married to a wife, that contacts the virus. They give birth to their child. The child becomes hepatitis B positive from birth, and that's dangerous. The lower the age at which infection happens, the higher the probability that an individual will have liver cancer in life. The let me not say the good thing, but the fairer thing about getting hepatitis infection when you're an adult is you are not likely to have liver cancer. But when a child, an innocent child, gets hepatitis at such a young age, at birth especially, it's almost 90% certain that he's going to have hepatitis B later in life. And that might be 50, 60 years down the drain. So now, if all this kind of information does not go out, it's very detrimental to the community. So as I sit down, the second point is that we need to organize community-based activity. We need to go to them, okay? One-on-one, you have to ask about their health. You have to do education sessions, home visits, door-to-door interactions. Everything is needed to be done. You need to go to companies, and I'm going to be sharing with you. There was a slide I inserted that I didn't send to the one, but I'll just share it when it gets to that stage. The one with Oluchi that we're seeing now. There's a slide I'll just quickly put in. So, yes, the next slide, please. So we need to educate people from HRGs. HRGs, high risk groups. Okay, who are the high risk groups? The sex workers, all right. Men having sex with men, all right. Uh, people, uh, that travel a lot. Travelers are very, very exposed. Truck drivers. I got that. That's very interesting. Truck drivers, and people that visit commercial sex workers and so on. We need to start from them. We need to educate them about hepatitis B and C. It's very important we start from them, and it's also important that we let them know that immunization is available, and in case they are already infected, we need to be ready to refer them for treatment. All right, then we need to get to, after leaving the the high risk groups, we now need to go to the general public that are not high risk groups. That's talking about the everyday person, right? We need to be able to generate awareness and prevent the spread of infections. That is very critical. The next one, please. And so, what are we doing? In my own sphere, preventive health Nigeria. You can see how many of this we have done. We have done so many over the years. You can see me in the radio station, that is direct to public. You can see me with those girls. That is a community outreach we had with the Redeemed Christian Church of God, LP21. We had 500 girls, 500 girls that got vaccinated against the cervical and the HPV vaccine. Now we are trying to get them back for hepatitis B as well. That was a big one. A lot of resources went into that because of the cooperation. We had to work with the church. We actually went to the church. We had to go there and let them know the severity of the disease and so on, and before they agreed, to be, there was obviously no need for screening for these girls, but if we're to deal with the higher, the older girls, we'll have to screen them. So you can see World Hepatitis Day with Professor Onyekwere. We've been doing that. This will be the sixth edition, 6 years back to back. Since 2019, we've not, every World Hepatitis Day, we've been doing it. That is for healthcare professionals. So we have the humanly possible version of the vaccine virtual summit. That's the World Immunization Week. And so you see the honorable minister there. We're in very good contact with him, and he's getting really involved with us. So we have, I think there was one I did for West African pharmacy students or something. So we're out there. Yeah, you can show us more. The next slide, please. So what are we trying to do? We're trying to make it in such a way that whether you belong to the general public, that's the one to the left, or if you are the HCP, that's the one to the right, you can click into our website or into our SoundCloud, app, and be able to get information on any of the vaccine preventable disease, the hepatitis, and so on and so forth. And we've been doing that for since 2019 or 2018, since I left GSK. So the next one, please. And thousands of healthcare professionals all across the world have been able to benefit from this. But before I take this, I want to share, there are some skills you need. There are certain skills you need as a young pharmacist to be able to uh, coordinate with other resources. You need to get, just like we said, how do we make sure that we are, what's the title of, let me get the title again. You are facilitating partnerships and community support to improve hepatitis screening, awareness, and prevention. So let me share some of this with you. It's not on the screen, but let me just read them to you. You need, everything you need is already out there. You don't need to reinvent anything, just like I said. The first skill you need is networking. For me to do what I'm doing today, was people I met when I was a product manager, people I met when I was when I met. So I was able, for example, Professor Galadanchi is someone that I met while I was in the north as a district manager, and I later got to know her. When I started doing what I'm doing now, I had to network with her, and now January this year we came together with the Honorable Minister for Health, who I also met while I was working with JFK and so on and so forth, and we did a very powerful meeting to raise awareness about cervical cancer. I know we are talking about hepatitis B, but it's the same thing, so networking, you need to be able to network. There is a particular professor that's on our board, Professor Richard Adigbola, who I knew. He was a staff. He was a global scientific director for GSK for vaccines. For the entire sub-Saharan Africa. He was working from Belgium then. So I met him. I said, I want to work with you. So he said, yeah, I'll come on your board. He's a very big man, but he's on my board. And today we work together almost every day to make sure that we are pushing out vaccine preventable disease information and so on. So networking is very, very key. The second is proposal writing. I hope you are jotting. You need to be able to write proposal. Please, I'm ready to train you. Uh, I have to my record, there's no proposal I've ever written that's been turned down. And I mean that with all sense of responsibility. You can't say no to my proposal because, by the grace of God, God has trained me and I've learned from many people on how to write it. So you need to be able to write. What do you want to do? I could hear the proud speaker talking about writing to Africa back, or one of these societies and so on. You must be able to communicate your point to a school. Uh, and I've done this for different chain pharmacies, MedPlus, Baidu, name all of them and so on and so forth. Being able to train their people on how to, put forward a case. What is your proposal? Before you go to your proposal, you need to talk about the situation. All right. What is the current situation? What's your target? Then what are you proposing? There's a way you write it, and nobody will say no to what you're writing. So YPG, if you need my services, you can get back to me on that. All right. Collaboration is also very important. The power speaker talked about it. We can't do everything as pharmacists, and that's what I push back all the time. If you see our board, we have doctors, we have different people that work with us. Whenever we do all these our big problem, programs, nurses are important. You can't be the one injecting, counseling, writing proposal. You need to delegate. You need to work with different members of the healthcare professional. You need to work with lab scientists. You need to collaborate and so on and so forth. The next one is sponsorship. You need money. A lot of money goes into what we do. A lot of money. All right. So you need to be able to, currently we have sponsors. All right, that put in the money because they believe in what we're doing. So you need to let people believe in what you're doing by being consistent. When you are concerned what you're doing, people believe. People tend to believe more when you have results and when you are starting. But as you continue, you're going to get what you want. You need IT skills. I That's not my profession, or that's not my specialty. Just like you saw in the last few minutes. I mean, I delegate all this to other people. So, but you must not have somebody that you know, or that's in your team, or that you're going to pay to do your IT and social media skills for you. Also, you need to reach out to the larger society, and majority of that will be done through, the virtual way. I do most of the things I do are done virtually, and we have gotten a lot. Can you imagine in our database now we have more than 1,000 healthcare professionals, more than not just in Nigeria, we have in Ghana, we have in Canada, we have in London, we have in US, and so on. All through, building capacity virtually. The last one is stakeholder mapping and management. So you need to know the people relevant in a particular field. I got to know that there's a group of social gastroenterologists that get together every month. So why will I reinvent the wheels when I want to do a World Hepatitis Day, symposium? So you need to be able to, know the right people and manage them, because relationships are very interesting. They go here, but you must know what you want and stay with. There are people you work with that you might not like their style, but because you know what you need, you just need to stay with it. I hope I've helped you with that. In rounding up, we are having our symposium. This is the sixth edition. By next week, Tuesday. Please, YPG, please, I want you all to attend. I want you to spread the news. It's free to attend. We don't charge for our meetings at all. Everything is free. But when you get there, you know that you are rubbing minds with experts across the world, and you are getting the best. Professor Charles Onyekere is a gastroenterologist, well known in Lagos. He has treated people that you can't even imagine. Is well respected all across, the country and outside Nigeria. So please help us uh, to spread the word and change the narrative with us. We are networking, we are collaborating, we are getting sponsored. We are doing everything I said. That's what is going into this. So a lot goes into these meetings that you see. The next slide, please. So that's a last slide. I want to thank you very much, YPG. You are doing great. Thank you, Oluchi, for contacting me. Thank you, Farm. I really, really appreciate all of you deeply, honestly. You guys are hungry and you pull out stuff from us that we don't even know we know. But let's continue this journey and we'll be happy to take all questions. So back to you, facilitator. Thank you. And apologies for all the, you know, all the issues with Google Meet and all that. You know, apologies. Thank you very much.
Thank you so much, Francola. That was another wonderful one from you. No pro- Thank you so much. So, from everybody, I'm sure that today you've gotten a lot of information that you thought wasn't necessary, or you thought that you don't know that existing. So, for those that have questions, you can start. If you want to talk, you can unmute yourself and talk. If you want to send it as a message, you can send it as a chat in the chat box. So, we have like let's just give 10 minutes for the questions. So we're waiting. While others are sending in their question, I wanted to ask, you said something about the question is for you from caller about one. I forgot the arrangement. You're talking about how Gavi are the one that pay UNICEF, Procure, and NGO, like those arrangements. I didn't get everything.
Okay, so this is the way it goes. So GSK comes up with a vaccine now. All right. So I can't go into many details for the rest. When we want to do our own meeting, we spend like 3 hours, but I can't do that here. So let me just be very brief. Uh, a company, there are very few that come up with new vaccines. For example, GSK now has the RSV vaccines. All right. It's respiratory, one funny word, S, and virus. So it's a respiratory disease in children and adults and so on and so forth. They have more of that over there. So now they approach WHO. We have this new vaccine. WHO approves it. They do their own study, they request for phase 4 and all that, then they approve it for use. All right. But now don't forget that the biggest buyers of vaccines are governments. Until you get governments to commit, you can't even manufacture when you don't have a go ahead, when you don't know the people that will buy it. So for you to get these countries to buy from you, you need, especially if it's a low and middle income country. Let's take the new malaria vaccine for example. So GSK is not just selling to Nigeria directly. The Global Alliance for Vaccines and Immunization, all right, they are the ones that will put the money down, all right. And so Nigeria, you pay 60%, you will pay 40% for the next 5 years. After 5 years, you do the full payment. So that will mean that they are subsidizing the vaccine for us. But then they won't, Gavi is not going to pay GSK directly, they will pay UNICEF. All right. So UNICEF is the procuring agency. UNICEF is the one that will take it, all right, from GSK, all right, and now bring it into Nigeria. When it gets into Nigeria, it gets to the Nigerian government, all the stakeholders. So you can see that it's a marriage of many, many, foreign agencies, donors. And I've not talked about Bill and Melinda Gates and so on. So all of them have their own contribution before we can have those vaccines free in quotes to the Nigerian child. So I hope I've shed some light on that.
Yes, sir. Thank you so much, sir. That was like a more broad explanation.
Thank you.
Okay, so we have a question in the chat box. Them from Margaret Dixon. The question is for you, from caller. During testing, and you find a person positive to hepatitis B positive, hepatitis B, what is the next step of action? How can you treat this? And how can we improve on the storage capacity we have for our vaccines? These two questions are okay. The first question is for you in particular. The second one is just a general question. Any of the speaker could give an answer to that.
Okay, let me start with this first question. Maybe I should start from the home storage facility. Uh, the first thing, what I usually advise pharmacies, and I'm sure you're talking about your pharmacy, don't turn, don't become a distributor. don't become a store. You know what I mean by that is there are people that is the work to do. You have place where you have network, you have vaccine farm in Lagos here, all right? If you don't need if you don't need 10 vaccines, don't keep them. Keep what you need in order for what you need when you do need it. In other words, when you have that patient show up, or the patient has made a down payment, that's the time to tell. You send a message to network. I need so. Somebody could say, "Why is that not cumbersome?" It's not cumbersome because you are reducing your risk. You know, the risk of a failure of power, or a mistake of opening that fridge and you have exposed it to sunlight, you know, a lot of things will happen. And anytime you incur more cost, you are supposed to transfer that cost to the patient. All right. For example, if you have to destroy vaccines, all that's a lot of money. You know how more vaccines cost now. The power speaker talked about how much, I have good information now that the hepatitis B vaccine I used to be about 2,000 is going to be about 30,000 or so very soon. So you don't want to mess around with supply chain issues when you can do it, get it when it is needed. So if your capacity is to do two in a week, just get those two when you need them. When you become bigger and people begin to, and that's where marketing comes. You can come in and help you to set up a very good marketing strategy. That's what we do, so that you can increase the volumes. And that's when you now need to start talking about, okay, do you need a solar powered fridge? Or do you want to, the fridge you used to use for both drugs and vaccines? Do you want to just dedicate more to vaccines? Or you want to, go into the big business, buy a big vaccine fridge? You don't just make those kind of decisions in the DP. You need to really plan ahead and see what the supply chain looks like. So I hope I answered that. And the first one is if somebody tests positive for HBV, hepatitis B virus. So just like I said one of the trainings for healthcare professionals is the training to be able to even interpret these results accurately. And let's say the hepatitis B surface antigen is positive, so that means there's an ongoing infection. Obviously, you cannot vaccinate the person because the vaccine has no value at that point in time. You cannot prevent what you already have. So what you do is the simplest thing to do is to refer that person, all right, to the clinic. Let the person get treated. My other speaker talked about us not trying to do everything. Now that we have assisted them, obviously, you should be able to make the money from the treatment. I mean, you should be the one. There should be an agreement between you and the clinic. But if they refer this to you, you will be the one to supply the drugs. It's not that the doctor now sits down on all your money and all that. That should not happen. So that's what I will encourage. So you must have a plan for referral for those that test positive, all right? And you must know how to advise when it comes to the best drugs to use, just like my other speaker has made it very clear about the choice of drugs. When it comes to the choice of drugs, those things are more complicated than some people think. So don't try and manage the patient on your own because there could be more things you need to look out for that you're not looking out for. All right. So that's what I say. So treatment goes. So treatment should start immediately after a positive report and the person tests positive. So that's first done by referring and by monitoring that patient is very important because just like that patient will have to take that drug for the rest of his life. So you need to monitor that patient. Don't leave him alone. You have to track that patient. And now another thing you need to do is that for that patient that tested positive, all right, you need to go a step further and find out about the dependents. If the person is married, you need to encourage that person to bring his wife, all right, so that she also gets tested. If the wife is not positive yet, please get the person's commitment to get that woman vaccinated so that the damage will not, be worse than that. Then the children, all right, then the how you don't vaccinate the household without vaccinating the house help, because if that house help is still negative, there's still much more he or she can do. So that's how it goes. Vaccinate the people around the person, or if the wife is already positive too, and then you need to pass, the wife over to treatment as well. Then the psychological management. I think one of the things we forget is that because we are healthcare professionals, because because we're not on the receiving end, you come for a test, and all of a sudden you hear that hepatitis B, it's not funny at all, and the person knows the implication of that. So you need to be able to know how to manage the psychological burden that the person has gotten into. So I think these are the things we forget, because people are not just physical bodies; they have mind, the emotions, the trauma, the how people around them will begin to stigmatize them. So you need to know how to manage. So before you plan an outreach, make sure you have all this in place. How do we manage the people that are positive? All right. What do we do to them? How do we manage them psychologically? How do we refer them? And so on. How do we manage their family? If the person, I'm not married, and then they found out that the person is, hepatitis B positive. Do you have a girlfriend? All those things must be done. You cannot, you have to think through it before you go ahead with the uh, outreach. So I hope I've expounded on that. Thank you.
Okay, thank you very much, Farm Caller. I think there is another question, and it's a general question, so I think either speakers can answer. And this is from Margaret Dixon. I don't know. Okay, yes, you already answered that question on how we can improve storage capacity for our vaccines. I think you mentioned something about inventory and how we should store the product. You do mention, I actually heard that. I don't know if you're answering to that question or.
Yeah, but I've already answered it. I talked
Okay.
about inventory management. You don't need
Yes,
to keep
yes,
everything. Then,
yeah.
if you get bigger, you need to make a quality decision. What kind of fridge you want? You need to get specialists to consult to let you know what best you can get at every point in time. Yeah.
Okay. So I personally asked some questions as well, and I said that getting vaccines for hepatitis is very expensive, and this is a major problem. So what do you think young pharmacists can do to convince patients to probably to take vaccines, to get vaccinated? Because I think the financial aspect is hitting a lot more hard, and now telling patients to buy vaccines or to take vaccines with the current amount of hepatitis vaccines now, it's not going to be easy. So, what do you think as young pharmacists? What should we do, or how can we go around this?
Well, if I may go first, I know my co-speaker might have something to also say about this.
Yeah, so you can
Yeah,
give your own idea, and
yeah,
he can
le-
give his
yeah.
additional idea.
Let me go first on that.
Okay,
This
okay,
is very practical. I mean, just like I said, we work with pharmacies that we consult for, and we give them strategy plans, how to do this, how to do that, and all that. They already know. So when they are doing their SWOT analysis, they already know that cost of vaccines is now a major threat to the vaccine business, the private vaccine business. Okay, for the public vaccine business, there is no difference, because people that will pay anyway. But for the private vaccines, this is a very challenging time for those that are in that space. Because don't forget now that a good number of people that you are going to see, maybe not in the pharmacy, but in the clinics, a percentage of them will already have some level of HMOs. That is, if they are working with a company or whatever. So, good, that shields people from paying directly. All right. So, if you are with Liberty Blue, I think Liberty Blue covers for most of the childhood vaccines, even for some adult vaccines. That's just some of them. All right. Then I know of some other good ones, or Axamansard as well, but other ones might not be able to cover. So, and what we are hearing now is that even these HMOs are now beginning to get more selective now, because it's weighing on their bottom line. In other words, if I want to give you 5 vaccines, I will prioritize the one that's very important to you because your company is paying me 15 million every year. And if I give you all the vaccines and all your children and everybody, what you are taking out of that pool is not enough for us to even pay our workers. So it's now becoming challenging. I think what we can do as young pharmacists is more and more advocacy. You guys are big enough to make your voices to be heard. That's why we're talking about partnerships, about all these things. We can. There's a World Hepatitis Alliance. There are many, many, groups across the world. There's even one coalition for people in Africa, CHIP, coalition against hepatitis. Uh, in people in Africa, so cheaper or something. So there are a lot of them. I think it's about time to start writing these proposals and letting them know the burden in Nigeria is very high. Nigeria has the highest burden in Africa. And what that means is, if that burden is getting higher, then that 2030 goal is not going to be met. And just like the Millennial Development Goals, which is now the Sustainable Development Goals, health is number 2. Health is on top of all those things. So if collaboration is like, think about maybe number 10 or so, then there are like 3 SDG goals that speak to health. So anything is a top agenda for any organization now, WHO and so on and so forth. So it's time. I think one of the takeaways from this meeting is how do we make sure that we write quality proposals to be able to request for support. So if the World Hepatitis Alliance or the CHIPA or whatever, you see a lot of them on the internet. I can't guarantee you that you just write a memo to them and they start sending dollars to you. That's not what I'm saying. But we need to build that momentum. People like us can assist. And once they know you are a coalition of maybe 600, 700 people, and you're all saying with one voice that there is need for support to be able to get more doses. Now, it's not just the amount now. Okay, Margaret, it's not just the amount of purchasing now. The issue now as we speak is there even enough doses coming into Nigeria? uh, Having been in this space for a while, I know the highest number of doses we sold in a year in GST was 30,000 doses. I mean, for hepatitis B, that's very shocking, right? You think that we're selling like 100,000? No, 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 we never did that. So I don't. The numbers I don't think will be too different now because once GSK leaves, the space, you really cannot get another force that's as big as that to pull in that level of resources to we spent a lot of money. My A&P every year was in tens of millions. So we were spending money to make money. And who is spending that level of money now? Non-existent. So I mean, I speak to some companies. I know that what they have now is just a few doses. So it's not just about the amount; it's also about the supply chain issues. So when you are thinking about writing this proposal or seeking for collaboration and partnerships to facilitate better prevention, what our advice is you make it as comprehensive as possible. You are able to paint the current situation. And you say the target is to meet the 2030 goals, which is 90, 90, 65, just like I presented to you. And the proposal is XYZ. We want more doses to come into Nigeria because of this, because of this, because of this. And and if they do that, they are able to bring the costs lower to us. They'll subsidize it just like Gavi does for public vaccine. So that's what, because they also get their money from different. So I hope I've been able to, speak to that. And coupled with that is to let people know, am I still being heard?
Yes, sir.
All
You
right.
are.
Coupled with that, yeah, that's a bigger picture. But let's come to the smaller picture now. Let's even say the hepatitis vaccine used to be like 15,000 to complete those 3 doses. If I may, sounds funny now. Also, it's their own fault too. When it was 2,000, they were begging everybody, nobody took it. Why? Why did they wait? But that's just to be funny. But the reality is that let's even say a single vial of hepatitis B, and you need three, right? And just like the speaker said, if a person has, issues with HIV or so, might need more than that. So, but let's go for the everyday patient now. We need three. That will be 30 times three, even if it's 30,000 or or whatever. So that 100,000, all right. If you spend it, uh, what are you paying for? You are paying for a life that is void of cancer. If the person does not get vaccinated and the person ends up with cancer, the person will drain all his life savings and still not recover from it. So that's the reality. So you need to be able to paint a picture that please don't say that vaccination is expensive because treatment, even if the person gets positive, right, and never gets the hepatocellular carcinoma, the cost of treating hepatitis, whether it's C or B, is so. I know there's no vaccine for C, so let's talk about B. The cost of staying on antiretrovirals for the rest of the person's life is so humongous, it's so big. Drugs are getting so expensive now, and that's if you get them. So please, while the vaccines are available, encourage other people and encourage yourself to get it. If there's nothing as expensive, there's nothing your biggest asset in your life is your health. So there's nothing you spend that is too much to get your health in place. So encourage people, even though we know the cost is high and all that, we'll do our best to shift, just rearrange the resources a little bit so that it will not be weighing on the patient. Other people will pay for it. That's what all this partnership is about. Let me give you an example now. I don't charge people for my meetings, but when I get support in sponsorship, that means the cost of attending that meeting has been transferred to another person. Might be a bigger company, maybe an individual, and so on, so on and so forth. So that's what we are trying to do. We need to do that, but in the meantime, let us preach the value of vaccines. If I take this vaccine, even if it's 100,000, what will it cost? There was one time that there was no HPV vaccine in the country, and I could remember that Medvac Sulukwe was bringing in the Gardasil at $100 per vial, and people were buying it from. I was so surprised. Nigerian parents were paying for it. It's interesting now now that it's free, people are throwing the vaccine away, but that's just human beings for you. When there's when there's demand, then the supply will be when the supply. So it's just. But what I'm saying is, those vaccines. If you're in America, if you're to take an hepatitis B vaccine in America, you won't be paying 30,000. It's much, much, much more than that. It's when they come here that they are subsidized, but it's due to our foreign exchange issues and all that. So from them, it's still subsidized. But then we can encourage people to still, put their health above their pocket. Because as a matter of fact, because you are healthy, you're able to go to work anyway. Thank you very much. Over.
All right, thank you very much, Pamkola. I really enjoyed how you answered the questions and you still even enlighten us more on what we should know. Fambetta, please, do you have anything to say concerning this question, just to hear your own point?
Mkola has, elaborately talked about everything we need to do as young pharmacists. But then I think I want to say create demand. Because the pharmacy setting is, as much as we are trying to enhance awareness, we want to make profits. So create demand in your outlets, create demand, tell people about the vaccine. Like as the World Pharmacist Day, I know World Pharmacist, World Hepatitis Day is oncoming now. You can start now to create demand down till 28. Tell people that okay, that if you need the vaccine, you can just put down your name and your contact and all of that. Then if you get as little as 10 persons who say we want this vaccine to be administered to us, then you can reach out to these organizations that can get you this vaccine. Tell them how much it is. Most people are willing to pay. The only thing is that the vaccines are scarce. Do you get me now? I know that the multi-dose vial now of hepatitis B is almost not available in the market. It's just single dose vials that we have. So create the demand. Awareness is important, but create demand so you can make profit along the line too. Do you get me now? And when you administer to one person, it means the person will have to come and take the 2 doses. So you already have return customers, coming to get these vaccines in the next couple of months. So create demand, and these things can be done. It's workable. Thank you.
All right, thank you very much, Van Bettel. I was also asking another question. I said, okay, do you think that in few years to come, hepatitis can actually be eradicated? Do we see any future? Do we see any light that viral this viral disease can actually be eradicated from Nigeria, considering the risk factors and also considering the preventive measures? Do you think?
Well, Van Betel, do you want to go first?
Well, I just want to leave a little tip from what we have from the World Organization. The goal we are looking at now is not 3 years. We're looking at eliminating hepatitis by 2030. Do you get? We are saying the what the organization is saying. Let's see a way to reduce hepatitis infection by 90%, and then reduce the deaths along with that is associated with hepatitis by 65%. So this goal has been made since 2016, and we're looking at 2030. So I think 2030 is a more reasonable time to see what we can do here. But the next 3 years, I'm not very certain of it, please.
Okay, Pankola.
Thank you very much, Van Betel. That's good. What we know, there's a difference between elimination and eradication. Uh, Elimination is what he has spoken about. I mean, if we get it down to like 90% or to like less than, I mean, if we get the cases to less than maybe 5%, so on and so forth, we have done well. Eradicate means there's no single trace of it on the planet again, just like we have in smallpox. The only place where smallpox exists now is in a test tube somewhere. All right. So if we're talking of elimination, is it possible in the nearest future? The goal that WHO has set, uh, things look impossible until they are done. Let me just say it that way. When we used to talk about polio, and it used to be the pain countries, pain. Pakistan, Afghanistan, India, and Nigeria. Those were the only four countries that were holding the world back. I mean, every other country had eliminated polio. I mean, there was no other, there was only these four countries. I used to think about it. Can we ever eliminate polio in Nigeria? Until, 4 years ago, when we achieved that milestone in Nigeria. Forget about Boko Haram that messed up the picture a little bit, but Nigeria is one of the countries that are now polio free. All right. I think we have just two countries left now. It's no longer the 10 countries now. India is out, I think. I think it's only Afghanistan, if I'm correct, or maybe it's just Pakistan, Afghanistan, something. So we have 6 years. If this is going to happen, it's not going to be word of mouth. It's not going to be just something we discuss. Excuse me. And that's part of what we want to achieve when we have the meeting on Tuesday. We want to go practical. What do you need to do? Who can you affect? Who can you talk to? What church can you advance? Can make an advance to, or can you approach to talk to the members? I told you about redeem. I've not had that level of success in people in years only. 500, that's a lot. That's 1,500 vaccines, potentially. And which schools do I want to work with? The high risk groups, or how do we get across to this? Unfortunately, now the economic situation of the country has made the commercial sex more whatever. So that means we have risk factors as a country that are increasing with the poverty. The poverty line has, just gone up and so on and so forth. With more poverty, there's more infectious disease. So just take it that way. So I would say that yes, we should do our best. What I'm doing in my own little corner, you are doing your own little corner. It might look small to you, but it's big at the end of the day. See what Bethel just said. Create the demand. Do a little. Let's just do our own bits and leave the rest to to the outcome. I think it's a big goal. I think uh to fall short of calling it humongous, but I think it's doable. if we really do our bit. Because at the end of the day, the truth is, by the time everybody does let's go to the Sustainable Development Goals, the Millennium Development Goals were supposed to be made by 2015. It was Nigeria. Nigeria was one of the countries that drew the whole world back. And that's why they came up with, oh, let's go for SDG. SDG is all, I mean, that was set for 2022. We've crossed 2022 again. Nigeria is still below the child mortality, a lot of things. So there are issues. So I will not say, I can't talk for the rest of the world. I'll say for Nigeria, I think it's a tall order. I'm looking forward to Tuesday. I want to ask the expert himself. What are the cases that we have seen in the last few years? Are they increasing? Are they decreasing? If they are increasing, then there's a cause for concern. And that's why I'm happy to be talking to you. I'm happy to be talking to Better and a whole lot of us can do that. So I've not said yes, I've not said no in a very stylish way. I hope you understand my points. Thank you.
All right. Thank you very much, Fabcola, for your answers. I really do appreciate them. Does anybody have any other questions to ask? I know some people probably did not drop any questions on the chat box, but if you want to speak, you can unmute yourself and share a word or two with Fabcola. Does anyone have anything to say?
We've seen what you gave us. Thank you, ma'am. Hello.
Hello. Pamekene, do you want to share something with us?
Oh, sorry. No,
Hello, good afternoon, sir.
that was an error. Sorry.
All right. Does
Okay, I
anybody?
want to speak on Famoluchi.
Okay.
I feel there's a question you dropped that has not been answered about the rapid test kits. If we can ascertain that, okay, that's a confirmatory
Yes,
test
yes. I,
result.
I I actually want to bring this to light because of, when we go for this awareness, probably the outreaches, and we purchase this rapid diagnostic test kits. But just to confirm, how can we depend on this rapid diagnostic test kit for the diagnosis we are getting from the people that are coming for the awareness, for the outreach? Because sometimes we have this outreach, and then probably say if we have 100 people coming, almost all of them coming are hepatitis negative. Probably just 2% will be positive. So I'm like, okay, it's not as if I am trying. I'm trying to look at, oh, we should have more negative than positive. But I'm just trying to look at the okay, is this something that we can depend on or not? I'm just looking at it from that perspective. And sometimes when we do these testings and they are negative, and then we now go for that to encourage them to take the vaccine, and some of them take the vaccines, whilst we are not very sure that this person is actually negative. So that's just my concern when it comes to the rapid diagnostic test kits. So I don't know how we can actually say, okay, this test kit is ideal, or this test kit is, I don't really know how we can address that as we go about our outreaches, because we're having an outreach soon, and pertaining to vaccines and vaccinations, all form of vaccines, and that will come up much later, and I will share that with everybody on this group much later too as well, using your emails. So that's all I just had to ask, but I don't know from Kola, is there anything?
Okay, the sensitivity, the specificity and the sensitivity. Now, the RDTs are very good with specificity, okay? But when it comes to sensitivity, I think the minimum that the WHO requires is 98%. All right, and they fail that test. So it's advisable that when we combine it with laboratory-based tests, we can be absolutely sure. And I know what is in your mind, which is that how convenient it is for somebody to do a test, then you send the person again to the lab and all that. In medicine, actually, less is more. I mean, it's better for somebody to have something than to have nothing. So that's the way it works. So you do your best. If yes, as a rule of thumb, you are very correct. Out of 100, you might just have just a few and all that. But that few, that one, that two is an individual that has a family that has, understand. So that's a huge number as well. So, but what I'll say is, with what you have, you do your best. What we were trying to achieve last year when we had our World Hepatitis Day was to be able to feed all these. I must say a very big thank you and kudos to all you do, all uh, you know, your efforts at making sure that you do outreaches and all that. But what we found out that there were gaps in terms of reporting all these successes and all those things and what we are doing into a central repository. What I mean by that is what you are doing as YPG, another set of people are doing their own in Ojelegba, they are doing whatever Mrs. Lawal is doing, Mrs. Ibuke. So we are all doing in pockets. But how do we make sure that the health authorities actually know that we have screened 5,000 people in Lagos, and now we can confirm that out of that 5,000 people is only 25 or 50 that are negative. All these things will actually determine, and back to your question on the 2030 target, do you know that it's interesting that as I speak today, there is no register that captures all these things as a pool and can be able to say in Nigeria, this is what we have done, this is where we are, is non-existent. Maybe by the time we have a meeting on Tuesday, the prof will be able to tell us that we have moved from where we were. But as our last year, it was very, 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 let me not say embarrassing when we found out that there was no such register. So what I'm driving at is if we begin to capture all these things, the number of people we screened, the number of people we vaccinated, all this is very, very important data to the country. So if we can capture it on the state level, we capture it on the regional level, we capture it on the national level, the country can now start making decisions based on data, because you and I know that data is something we are trying to improve on in this country. So why I'm saying that again is that if we now know that all of you victory drugs, medvac, everybody, we're all using the RDT. This is a type of RDT, and WHO has already told us that the sensitivity of the RDT when it was approving it was 97%. We can use that data also to determine how much, we can use percentiles and all that to determine whether what we are doing is worthwhile or whether they need to go back to the lab. Because don't forget that eventually this data will last until we're able to examine these people and see whether in the future they end up with the liver carcinoma and so on. We can trace it back. So that's it. That's the way things work in advanced countries. They won't say no, RGTs don't work and throw them away. No, 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 no. They keep working with them until they are able to develop robust data that they can now make decisions on. So keep using what you're using, but make sure it's recorded and reassure people that they get vaccinated and they have tested negative and they get vaccinated, they are good. Then in making a choice about the RDT, I know we don't have too many choices, the one they give us, but I know that Zolon is trying to get some across free of charge and so on. I know that they are also trying their best, but it's also good for us to double check. Okay, before we start using it, let's check the sensitivity level, the specificity level, and whatever they say, and and so on, and get expert advice. But if that's what we have, that's what we're going to use. Thank you.
All right, thank you very much, Fabcola. I really do enjoy the way you answer your questions. I must confess, and you've given us all our answers. You've answered all my questions, and I believe everybody here is satisfied. I speak for everyone though, but
Thank you, Oluchi.
if you probably are not satisfied, kindly let me know via my email. You can email me or email PSN-YPG Lagos@gmail.com, and we'll take into consideration your consent. All right, thank you very much everyone here for joining this meeting. I really want to specially thank Famcola. Fam Bethel had to leave the meeting because he had another meeting clashing with this one, so he had to leave. And we appreciate him and we appreciate Famcola for taking out time, their commitment, their advocacy to preventive health and hepatitis and all forms of health that can be prevented. He mentioned something. He said that health your health is your asset. Okay, and I'm really taking that word to heart, that your health is your asset. Let's take that as our priority. Let's treat that as our priority, and also take this message from here and take it to our patients, our loved ones, everyone around us, because it is a major concern for everybody. All right. Thank you very much, everyone, for joining this meeting. Thank you once again, Farm Cola. We really appreciate your 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 commitment. Anytime we call on him, he's always available to attend to us. The last time we had a World Immunization Day, he was also there to attend to us. He has never let us down, and we are very much thankful and we appreciate all that you're doing for us. So thank you very much, everyone here. Thank you very much
You're
for
welcome, Oluchi. Thank you for calling on us, and we will
yes,
do all our best to make sure we support you, because what you are doing is very laudable. That's why I will encourage you, always document what you do. If
yes,
you
sir.
do an outreach, make sure you have a report stored somewhere so that you can share it. Look for ways of sharing your results with the health authorities that are closer to you. You can talk to people like us. We can connect you with the right people, so that what you are doing, everybody will see what you're doing. Is not to just show off, but for people to recognize the value you are adding to the system. And I just sent you the registration details to the our meeting, the Professor Onyekwere's meeting of
Okay.
we prevented health on Tuesday. Please help us spread the word. Please register, attend, and encourage others to do so. Thank you very much. God bless you all. Thank
All
you.
right. Thank you very much, sir. I will do so. I will spread the word, and so that we can get more insights and be enlightened. Thank you very much, sir.
Yeah.
All right.
Okay.
Thank you all for
Okay.
joining.
All right.
If you've not left your email and your full name for certificate of participation, kindly do that, or else you won't get the certificate, and I won't be blamed for that. Please,
Bye,
if you
everyone.
hello, sir.
Bye, everyone. I
All
can
right,
I
bye,
leave now?
sir. Yes, sir. Thank you very much,
All
sir.
right. You're welcome.
Sir,
Thank you.
thank
Yeah, bye.
you. Thank you.
Bye.
All right, bye everyone. Thank you very much. Don't forget to leave your name, your email address if you're interested in getting certificates. That is, well, if you're not interested, of course, you can proceed. It's not compulsory. Full name and email address, not just your full name. There's no email. If there's no email address, you won't still get the certificate because I don't know who to send it to. So please drop your email address and your full name. All right, thank you all for joining. The meeting has ended though. Thank you. Your full name and your email address. Please, I'll just run this for a few minutes and I will also leave the meeting once it is 2:20. Let me see.
Okay, have a lovely day, everyone.
Okay, so I think I will be out of here. I also have another engagement. Thank you all for joining the meeting. Good day, everyone.